It's always difficult, I think, to judge whether it's coming at a good time. What I'm looking forward to, obviously, is retirement itself. I've been involved in the NHS representing members at all levels, at local level, regional level and national level for 37 years. And after 37 years, of course, I reflect on the significant changes that have taken place in the health service in that time. I started in March 1979, and by November 1979, the first major change took place for a few years, which was proposals from Margaret Thatcher's government called Patients First. And then there were more changes in the 80s, and then we had the 1990 Act, and then subsequently major changes that came about under Blair and Brown, and then of course we had the major changes created by Andrew Lansley in the 2012 Act, which only applied to England. And one of the things that is very interesting is that as you look back over all those years, what you've seen, because of the devolution agenda, are significant changes in the way that health is delivered, or healthcare is delivered, across England compared to Wales, Scotland and Northern Ireland. Well, I started my working life, because I tried to be a student as long as possible, but eventually I had to get a job. I started in the civil service, and I became very active in one of the civil service unions that existed at that time. And as a consequence, I became a Whitley Council Starside Secretary, so I was doing nothing but union work. And as a consequence of that, I decided to apply for jobs as a full-time officer with unions. And I was successful with my application for the British Medical Association, the BMA. So from 1979 through to 2004, I worked for the BMA at a time, of course, when there were significant changes taking place right across the NHS. So from then, I moved to a small union. I looked for 2 years after the chiropodists and podiatrists when they were setting up their union activities, which included affiliation to the TUC, which we were very successful in campaigning for the members of that union to go into the TUC. And then I joined what was then MSF in 1997, and of course MSF became Amicus, Amicus became Unite. So throughout that whole period since '97, I've been involved in the agenda that the union has been promoting to develop an agenda and a programme for the members we have in the NHS, and indeed right across the health sector, because obviously we've got members outside the NHS as well. And one of the most satisfying things is that we now have, following year-on-year growth in membership, we now have over 101,000 members in the health sector in Unite, making it the biggest sector. And that's a great tribute, I think, to all the work that's done by our local activists, our local reps, our branches, and of course our officers out in the field. But I think if I look at what I've been involved in Unite and its predecessor unions, the most significant one is Agenda for Change. From 1999 until January 2003, when we finally produced the draft proposals for Agenda for Change, I was involved in all the negotiations that took place then to create a harmonised contractual arrangement for 1.3 million people based on an equality-proof job evaluation system. I think it's right to say, without any hyperbole, that that's never been achieved anywhere else in the world. Where if you're looking at a job evaluation system that evaluates jobs and creates harmonised terms of service, that is something that is a real leader and is unique, is genuinely unique. After Agenda for Change and making sure that it was something that was fit for purpose and could be implemented, I think one of the big lessons that was learned from Agenda for Change was that the unions, the employers, and the departments of health in the four countries worked together on that to develop it, and that partnership working bore fruit in a very significant way. But then subsequently, the big challenge is what we had in 2010. In the election for 2010, the Conservative Party said that it would not produce any reorganisation of the NHS. There would be no top-down reorganisation. Yet within 2 months of the election in 2010, a white paper was published by Andrew Lansley, who was then the coalition government's the Secretary of State for Health, which augured a very significant restructuring of the NHS. And if you're looking at the biggest challenge that we've had in the last few years, undoubtedly, the proposals in that white paper and the subsequent bill and then the Act have created the most significant changes in the NHS since 1948. And I think importantly for Unite, at the time that the white paper was published, we then began our campaign to oppose it. And the opposition to the proposals in the bill were universal. I mean, there wasn't virtually a single organisation, even those you normally suspect would support what the coalition government wanted to do, oppose those proposals. So that big campaign was a major event for our members. It was a major event for all of us involved in the campaign against it. And although we didn't stop the bill, there were some changes made. And I think the most interesting thing is that it was a huge change for the NHS in England. There's been no change in Scotland. There's been no change in Northern Ireland. There's been no change in Wales. Does that mean that the English health service is infinitely superior to the three devolved administrations? Of course, the answer is no. That isn't the case. So the 2.5 billion that was spent on reorganising what happened in England is money that hasn't actually created something that stands apart from the other parts of the UK. And the interesting thing I think we're facing now is there is much of what came out from the 2012 Act which looks as if it's been quietly buried, being given a decent funeral somewhere, because a significant part of the objectives of that 2012 Act haven't really ever been fully realised. And so we are facing now an NHS where the major challenge is nothing to do with the new structures that were created. It's all to do with the amount of money which the current government is prepared to put into the NHS. And there's been a myth grown up that the money for the NHS has been protected. But of course it hasn't, because up until 2010, even during the Thatcher years, the average increase, real increase in NHS expenditure was around about the 4% mark. Since 2010 it's been 0.9. That's why you've now got the majority of trusts in England that are in deficit. And in fact it's now normal to be in deficit. So the joke is that it doesn't really matter if you're in deficit now because everyone else is. Whereas if you go back 4 or 5 years, to be in deficit meant that chief executives would resign and chairs would resign. That isn't happening because it's the established situation that we've got across the NHS when we've had, in real terms, an underfunding of the NHS for the last 5 years. We've experienced so many changes and so many reorganisations, we've got all the history of that to use. But what we are aware of is some famous cases, the most significant one from, it must be nearly 4 years ago now, in Waltham Forest. If our members, our health visitors and all the staff that they work with, the community nurses, etc., stand up and also go public in a way that gains political support and support indeed from some of the national politicians, then we know we're going to be in a strong position to rebut any claims that what is being proposed is something which doesn't affect the care that is being delivered, when we know very well it will affect the quality of care, and therefore it's something that can be publicly pressed as a major campaigning issue. I hope to see our membership continue to grow. Despite the fact that the NHS has got a pretty high level of union membership across all unions, you can still probably calculate that at least 300,000 staff in the NHS do not belong to any union. So one of the messages is make sure whoever you work with, whether you're a health visitor, whether you're a speech and language therapist, whether you're a healthcare scientist, make sure they join Unite. And within Unite, of course, we've got the CPHVA and we've got our other separate associations that are part of the Unite health sector, all contributing towards the strength of Unite. So that's one message. Another message, part of the message, is to ensure that you see campaigning as a vital way of protecting our members' interests and defending the quality of care in the NHS. So campaigning is a significant part, if not, of the agenda that should always be there. I think also in terms of a final message is that we should never believe that we will not win. Work on the basis you're going to win, you're setting off to win, and you set off to win, then you can achieve what Leicester City Football Club has achieved. Against odds of 5,000 to 1, you can still get there, you can still get the best for our members, and very importantly, the best for the patients and clients that you spend all your time in the NHS working for. We've had some really very talented people. We've got a professional officer team, we've got other colleagues working across the health sector who contribute very significantly to the value and the excellence of the work that we do. And the simple message is, long may that continue.